This is the injury report presented by NYU Langone Health. Every Giants fan knows the terrible news by now. Wide receiver Malik Nabers is out for the rest of the year after tearing his ACL. So what does that mean for his future? And I'm going to get Jets fans an update on running back Brilen Allen, who sprained his MCL on Monday Night Football. Today's injury report is all about the knee. We got Dr. Michael J. Alaia, Sports Orthopedic Surgeon at NYU Langone Health, with everything you need to know about these guys returning to play. Little dad joke there, but this is nothing to joke about for both franchises. I guess we'll start with Malik Nabers. First and foremost, what's going on, Doc? But there's this viral picture that's going around the internet of Nabers hanging with his favorite rapper, NBA Youngboy, after he tore the ACL. He's got the brace over his jeans, and then he also has a crutch under his right side as well. So why doesn't he need surgery right away? And what's that process and timeline going to be like to fix the ACL?
Yeah, well, first, it's good to see you. It's good to be back. It's good to talk to you. I understand what a lot of people are going through seeing Malik Nabers kind of go down like this, especially as a Giant fan myself. It's difficult to fully grasp this. But, you see him on the sidelines with his favorite rapper. That's always a good thing that he's up and on his feet. He's getting around, walking, ambulating. So those are all good things. Now, the reason that we don't go into surgery right away, typically after an ACL is torn, is because what happens is the knee fills up with blood. And that inflammatory process is almost like an initial hit on the knee, where it gets very inflamed, and you want to get the knee swelling to be gone before we go in and do a reconstructive surgery on that knee. Not only do we want the swelling to go away, we also want the patient's motion to be nearly normal, full extension, full flexion, minimal pain. We wait until the knee is sort of biologically quiet before we intervene surgically, because if you go in too early and give a second hit, then you could potentially make the patient a lot stiffer. And if a patient like Malik Nabers, who relies on his knees for high velocity impact type plays, if you make that patient's knee more stiff, then they're not going to have the outcome that they want.
High velocity impact plays have less impact on grass. And everyone is blaming the turf at MetLife Stadium for this injury. He ain't the only high-profile football player to suffer a non-contact season-ending injury, Doc. So I know you're not a real turf expert, but can field turf kind of add to the risk of these injuries in these athletes, like meaning like the wear and tear and maybe not giving out like grass does?
So the answer to that question shortly is yes. It has been shown in several studies in great journals like the American Journal of Sports Medicine that, particularly in the NFL, there is a higher risk of non-contact knee injuries like ACL tears when you're talking about turf. Now, we're not talking about an exponentially higher rate of tearing. We're talking about a small increase in the rate of tears in ACLs when you consider turf. So people still tear their ACLs and their knees on grass all the time. I mean, look at last night. Tyreek Hill sustained a devastating injury to the knee, and that was on a grass field. So knee injuries can certainly happen on grass, but the reasons why they might be a little bit more common on turf is because the surface grip of turf is very high, right? So the cleats grip the turf very, very substantially. And what happens with that is that the cleats don't release. So they kind of get stuck there. It's almost like a skier when the bindings don't come off and you twist the leg, instead of the ski coming off, what happens is you rotate through the knee and the ligament tears instead. So that's one reason why ACL tears tend to be a little bit more common on turf, is because of that low or poor cleat release. And then you think about the shock absorption also. Turf tends to be a little bit harder, so the shock absorption is a little lower compared to grass. So if theoretically, if that grass can absorb shock a little bit better, then potentially the knees can be protected.
I'm glad we have you on because the knee is your expertise. And you know now that ACL injuries aren't career ending like back when my dad played. So like the typical recovery or the timeline for a guy like Malik Nabers or elite athletes, they're coming back the next year, kind of some even bigger, faster, stronger. So what are the new surgical techniques that's been created to get these guys back out there faster after an ACL injury?
So I think we're still in that era of tried and true surgery where Our techniques have not changed very much over the past 15 years. Back when your dad had ACL surgery, we used to do those with big open incisions where not only did we reconstruct the ACL, but we used to also tighten the MCL, take out the medial meniscus, which is just we know now is a horrible idea. Back when Joe Namath had his ACL done, that was the only thing we knew how to do. And it gave Namath maybe 5 years more on his career, but he needed knee replacements. Now we've got anatomic reconstructive techniques where we can go in and almost nearly perfectly reconstruct an ACL. Now, we can't give the patient what God gave them in terms of what the ligaments look like when it attaches on the femur bone and attaches on the tibia bone, but we can give them a really, really anatomic reconstruction. We have some adjuncts in place where we can add to it, but those haven't really borne out as something that can get you back to play within the net earlier than 6 months. 6 months for these high impact athletes is really still the earliest we can get them back out there. You look at Adrian Peterson and what happened to him maybe 8 to 10 years ago. He came back from ACL surgery about 6 months after his surgery, and he had probably one of the best careers we've ever seen in NFL running backs. He came back at a level that was better than what he was preoperatively, which was nothing short of spectacular. But we've got such great physical therapists and athletic trainers that can get these players back early because we know what to do with their muscles, with their landing mechanics, with their rehabilitation. Surgery, we do great. The surgery is the easy part. It's the recovery and the rehabilitation that's the more difficult part.
Now, for the Jets fan that's still watching right now, I know it wasn't an ACL tear, but running back Brilen Allen sustained an MCL sprain during that loss in Miami. He's a big physical type running back. What's his timeline to be back to 100%? And will this injury kind of slow him down when he does get back?
I think it all depends on how bad the MCL injury is. And when we as orthopedic surgeons classify MCL sprains, we grade them into three different types. So a type 1 tear is a very small tear or just a sprain where the tissue might stretch out a little bit, maybe a little bit of fluid around the ligament. And that could be as easy and as quick as 2 to 4 weeks to come back from. Typically, the patient or the player just needs to feel comfortable and be able to do all their activities on the field without jeopardizing their health or the health of anybody else on the field that they're playing with. When it comes to a type 2 tear, which is a little bit more of a tear inside the ligament, then it could be anywhere from 4 to 6 weeks. And when we talk about a type 3 tear, which is almost like a complete blowout or a complete tear of the ligament with significant instability when we test them on the examination table, that could be almost 3 months to recover from. So those injuries are typically about a 3 month recovery time. But I haven't heard too much about this injury, so my gut tells me it's probably going to be along those low grade highlights, either a 1 or a 2, and hopefully they'll be back on the field within 2 to 4 weeks.
Yeah, they put him on the 4-week IR, so he will be back in about 4 weeks when that gets back to 100%. So back to the ACL, how would you treat a non-pro athlete patient if they tore their ACL?
Well, we always weigh into perspective what a patient's activity status is. So there are a lot of 25-year-old, 30-year-old, even 50 or 70-year-old patients that have substantial pivoting as part of their lives or part of their enjoyment, and whether that be tennis or pickleball or skiing. I've got some patients that are elite skiers that are throwing down black diamonds or back hills skiing as if it's nothing. And those are patients that you have to treat like an elite athlete because part of their enjoyment and part of their lifestyle relies on it. So age, we say, is just a number. Their physiologic age is much more important. How active are they? So in New York, where I practice, we have tons of weekend warriors and patients and people that want an activity status that justifies pivoting and cutting. So a lot of people get treated the same ways as the elite athletes do. They get ACL reconstructions, they get ACL repairs. There's lots of things on our table. I mean, for me, ACL reconstruction is a tried and true way to get a patient back into the level of activity that they want to do. And we treat every patient that comes through the door as an elite athlete. Unless they prove that they're not, we're going to want to give them the best functional outcome as humanly possible.
That's elite service right there, Doc. That's why you guys are the best. Appreciate you hopping on with us.
My pleasure. It's always good to be back.